She filled prescriptions for other people's emergencies for 11 years and almost missed the one unfolding in her own living room. Bear did not miss it. Nadia Kowalski was a clinical pharmacist. She understood drug interactions. She understood systemic inflammatory responses. She understood the cascade that happened in a body when infection overwhelmed its defenses. She had counseled patients on sepsis recognition. She had printed the information cards. She had given them to elderly patients and new parents and anyone who would take one. She knew the signs. She did not recognize them in her daughter because Zoe had shown none of them in any recognizable order. Zoe was 19 months old. The week had been hard. A minor cold, some fussiness, reduced appetite. All normal for a toddler in November. All within the range Nadia knew was unremarkable. Bear was their 4-year-old Great Pyrenees, a large, calm white dog who had a designated sleeping spot beside the back door and a routine that had not varied in 2 years. On Monday night, he abandoned his spot and lay down on the floor beside Zoe's crib. He was there when Nadia checked at midnight. She moved him. He was back by 2 a.m. She noted it as unusual and attributed it to Zoe's disrupted sleep, the dog picking up on the restlessness. By Tuesday morning, he had not eaten. She made an appointment with the vet for Thursday. Bear did not eat Tuesday dinner. He did not eat Wednesday breakfast. He was not at his bowl. He was beside Zoe's crib, or beside Zoe on the playmat, or when she was carried from room to room, following close behind. Wherever Zoe was, Bear was 2 feet from her. Her husband Dmitri said on Wednesday afternoon, "He's been like this for 2.5 days. He's not eating. Something is wrong." Nadia said, "He's reading her mood. She's been off this week. He's sensitive to that." She had read that Great Pyrenees were especially attuned to the animals and people they protected. This fit. This was a known thing. She believed what she said. She was trained to be systematic, and this explanation was systematic. It did not require her to do anything. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you don't miss the next one. Wednesday night, Zoe woke at 1:47 a.m. She was crying, but the cry was different. Not the sharp frustration cry of a toddler who has lost a pacifier. Something slower, lower. Nadia was in the nursery in under a minute. Zoe was warm. Nadia took her temperature, 38.9 Celsius, which was elevated but not alarming. But Zoe's face was flushed and mottled in a pattern that was not the typical even flush of a fever. There were faint, blotchy areas. Her hands were cooler than her core. Her breathing was faster than normal for the temperature she was running. Nadia stood at the crib and said aloud to no one, "This is not a typical fever." She took Zoe to the ER at 2:14 a.m. The triage nurse moved them directly to a room. The attending physician, Dr. Omandi Achola, 14 years in emergency medicine, had blood cultures drawn within 6 minutes of assessment. He came back to them 2 hours later with results that moved him to antibiotics immediately. Streptococcal bacteremia, bacteria in the bloodstream. The precursor cascade to sepsis, caught at the earliest stage. Dr. Achola said her inflammatory markers were already elevated, consistent with a 2 to 3 day progression from an initial bacterial infection. Her presentation was atypical. The fever spike was delayed. She had early systemic involvement before the fever became prominent. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. He said, "Children this age can progress from this presentation to septic shock in under 12 hours. You brought her in the early window." He said it with the particular quietness of a physician stating something true. He said, "What brought you in tonight specifically?" Nadia said. The cry sounded different. She paused, and our dog had not left her side for 2.5 days and stopped eating. Dr. Achola looked at her. Dogs register inflammatory cytokine changes in human scent at concentrations below clinical detection. The change in your daughter's immune response would have been detectable to a dog for 1 to 2 days before visible symptoms. He said, "Your dog was reading her blood work before we could take it." He paused again. 2 to 3 more hours, and we would be having a very different conversation. Every guardian deserves to be recognized, even the ones who never ask for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Zoe spent 3 days in the hospital. She responded to antibiotics quickly. She came home on a Saturday morning. Nadia carried her through the front door, and Bear was there, as he had not been, at his spot beside the back door where he always slept. He walked to Zoe and pressed his nose gently near her neck, just below her jaw, for a long moment. Then he exhaled once and turned and went to his spot and lay down. Whatever he had been reading in her for 3 days, he could no longer read it. The infection was gone. His post was no longer required. Nadia sat on the kitchen floor for a while. Bear did not come back to her. He was done. He had done what he came to do. He was, as he had always been, simply keeping watch in the only way he knew how. The next story begins the night. A family's furnace started failing, and the only alarm that worked had 4 legs and a white coat.